John, how many coloring books did you fit in there? I said, how many coloring books did you fit in there?
There's 3 in there right now, but it's not anywhere near.
And 2 crayons, because they're those great big ones, you know.
Yeah. I say that out loud.
We'll start with the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the December 28, 2015 meeting for the Shawnee County Board of County Commissioners. My name is Kevin Cook. I serve as the chair, also representing District 2. Joining me today is Commissioner Shelley Bueller, representing District 1. Good morning.
Good morning.
And Commissioner Bob Archer, representing District 3. Good morning.
Good morning.
Madam Clerk, before we begin, on item G2, after meeting with our audit, finance, and HR, I'd like to defer action on that item until December the 23rd, so Thursday's agenda. 31st? Thank you.
That's okay.
Second.
So motion made by Commissioner Cook to defer G2 to 12/31. All in favor say aye. All opposed? Passes 3-0. With that, I think we're back on track and ready to start.
Okay. Item 3, consent agenda.
Are there any questions or comments regarding the consent agenda?
I'll move to approve the consent agenda as reported.
Second.
Motion made by Commissioner Archer for approval of the consent agenda, seconded by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. Our next item.
Item 4, new business, A, county clerk. There is no number 1, because there are no vouchers. There is no number 2, because there are no correction orders. But there is a number 3. And our number 3, it's the flexible spending, let's see, the consider approval of the plan documents and summary plan description from Central Trust Bank -ASI for the administration of the county's Section 125 flexible spending account. This is the item, I had the actual contract, annual contract renewal with ASI on earlier this year prior to our renewing our insurance, and I said we had another big plan document that was going to be coming back. This is that big document. There's some additional language that their attorney said that we needed to have in. It's just IRS. Nothing that's going to affect us. It's just some stuff as they were going through with the document, they said, you need to have this language in here because they are our Section 125. They're the ones that when we ever have any questions on, make sure that we're following all of the requirements under the cafeteria plan. When you take money pre-tax, we want to make sure we're doing everything right. So they went over it pretty much with a fine-tooth comb. They do it about every third or fourth time we have a renewal on it, and they put some extra language in there, and Counselor's Office reviewed it. I went through it word for word with the previous one, and Rich he personally went through it, totally in agreement with everything, and I just need to have you recommend that you approve it.
Any questions regarding it?
I guess just no changes for the plan itself to the employees or anything like that.
No.
Okay, thank you.
Just technical adjustments.
Yes,
The IRS.
And we know with IRS that there can always be technical adjustments with things.
With that, is there a motion for its approval?
So moved.
Motion by Commissioner Bueller for its approval.
Second.
Second by Commissioner Archer. All in favor say aye. All opposed? Passes 3-0. Our next item.
And I will just quickly, since I have a little commercial break here, on the flexible spending, this is for our ASI, we have both flexible spending and the child care. Now, the flexible spending, we have the option, our employees have the option to hold carry over up to $500. So if any employees out there, they're trying to figure out a way to use up all their money, they do not have to do that. We adopted that a couple years ago, so we can carry over up to $500 of their flexible spending. So, for just kind of, like I said, a commercial note to our employees that they do have that ability, and that's totally legal in our plan document. Okay?
Great.
Okay. Item A4, consider authorization and execution of contract C-564-2015 with Willis of Greater Topeka, Inc. for Shawnee County's 2016 insurance coverage for county's property at an annual premium cost of $735,349. Okay. And this morning, we have with us two representatives from the Willis Group of Greater Kansas. This is the property insurance is for our commercial property, our equipment, which is called inland marine, our crime coverage. We have boiler insurance, we have above-ground storage insurance, and we have automobile. We carry third-party liability on our automobile insurance, and we have above and underground storage tank insurance and excess work comp coverage. Now, we carry the excess work comp. Of course, we have our, we self-insure for a lot of stuff, but we carry the excess work comp for just exactly that, for anything in excess of whatever the statutory limits are. And they will be explaining that. Is Brian here? Okay. So I have Jan Mason and Brian Hassan from Willis that will be here too, and they will answer your questions. Brian's going to go over a little bit. Brian is, I think he was introduced to you last year. Brian, if you'd like to come forward. And he's going to go over a little bit of of what Willis, obviously the plan we have for this year, but also just to give you a little bit more information about the Willis, what Willis does for the county besides just this. So if you want to go, you have to go to the podium.
Thank you.
You don't get away from that, Brian.
Came in late. I was driving from Kansas City and quite a bit of snow and ice. Made it safely though, so thank you very much. So we are managing the property and casualty renewal.
You might, for Ms. Beck, let us know who you are.
Right. Brian Haston, Senior Vice President for Willis Insurance Broker, and we broker the property and casualty insurance for you all. So we have gone through, early on, we do a pre-renewal meeting with Cindy and focus on some benchmarking on pricing that the industry is at. The insurance industry obviously fluctuates. Right now, we are sitting at an insurance industry that is roughly between 2.5% to 5% of rate increases. We were able to negotiate underneath that for the Shawnee Board of Commissioners. Do you guys have a copy? I'll kind of walk you through. Majority of the premium that the county spends is on the property and casualty. Last year, we marketed the program, which means we took it out to probably 15 to 20 different markets looking for competitive bids. The property insurance market, last year we were able to yield about a 20% reduction off of rate. We do not market every year. It's best practices for organizations not to go out to the insurance market year after year. We find that the insurance marketplace doesn't find buyers serious, and we kind of, flood the marketplace and we don't get serious suitors. So this year we did not market. We were able to hold the rates flat, which is underneath what our benchmarking demonstrated. There is a slight premium increase because that is based off of exposure. So the values of the buildings and the contents that are being insured were higher, but the rate was flat. So the premium went from $332 to $340, and we were very happy with Cindy with that renewal. Crime coverage, which is also purchased, is with Travelers, by the way. We were at a flat rate on the crime. The automobile went from $235 to $242. We held it underneath a 2% rate increase on the auto, which beat our benchmarking pricing at about 4.2%. General liability, slight increase, small, less than $50. Umbrella, we were able to negotiate flat rates. The fleet physical damage, we also were roughly flat. It was about $400 rate increase, well underneath what our benchmarking demonstrated the market was yielding. Workers' compensation, we actually took a 2% rate increase on the workers' compensation. The payroll is actually down, which is the rating basis. So from a premium perspective, it's underneath what you paid last year, but the rate, in honesty, is about 2% higher than what you were paying. The above-ground storage tank, we are still waiting on the underwriter to get our renewal. We expect that to come in flat. We expect it today. We expected it Friday, or actually last Wednesday, but with the holidays, the underwriter didn't get back to us. It's roughly a premium about $5,000, and we expect that to be flat, if not slightly underneath. The medical professional liability went up from $15,000 to $22,000, and the rates were actually flat on that. It's that we took on a couple new physicians, and it's a claims-made policy, which means when you bring on a new individual, there's more tail coverage. So the first year they come in, there's no history that you're insuring. So as they come on another year, the rates will gradually increase over the next 3 to 5 years till they flatten out. So the total estimated premium went from $718 to $735. Any questions?
Can you touch on for a moment our medical professional liability insurance as we work through the safety net and working with, anticipated with Grace Med in the June-ish, July-ish area as we transition out of the community health care? How would that affect that if we no longer have those physicians?
If you no longer have the physicians, then you will not need to purchase the insurance for the medical malpractice liability. So that's how it will impact.
But if we're halfway through a year, do we adjustment or rebate?
Yeah, we would do a cancellation and adjustment on a pro rata basis.
Commissioners, do you have questions? Commissioner Archer?
Just a question on excess workers' comp.
Yes.
Can you explain that a little bit? Is that just like a stop loss for the county? How does that work?
It absolutely is. You are basically self-insuring the first $500,000 of every loss for an injured employee. So we're buying excess insurance, so if there were losses that aggregated over $500,000 on any one individual loss, then you would be buying insurance to protect yourself. It's relatively...
That's a high threshold.
It is a very high threshold, and based on your results, if we looked at it on a guaranteed cost basis where you did not take a self-insurance, your premium would be much higher than what you're basically paying if you take your losses, plus the premium for the excess. It's significantly less expensive for the county to be self-insured.
Thank you, Mr. Chair.
I did want to explain on the above-ground storage tank. We also, my office is part to blame for that because we provide them with the list of above-ground storage tanks, and there was one that we actually did not have. And so last week Jan had gotten hold of me and said, we're missing a tank. We know we're missing a tank. So she, well, because the state of Kansas, these all have to be licensed and stuff, and they get a list. So they knew we didn't have one. So we got the tank to them, and then they got it to the insurance company. So that's, so that really wasn't all theirs. We do a really good job in my office, but that one just went away. I don't know what happened to it.
We expect to have it by today, but they're in Colorado, the underwriter is, so we anticipated this morning.
Attachment to the tail end, we have a listing of different facilities that the county has. I don't know if you have it with what you have.
That's this.
Oh, the
Statement of
Values, yeah.
Are we insuring for actual cost? Are we insuring for replacement value? What do we look at?
Replacement costs.
Okay.
So if you do lose the building, we obviously want to replace it back to the commission.
All right. And I'm just going to pick the very first thing on the list, which is the Shawnee County Courthouse. You have it listed at $31,741,000.
Okay.
Is that an accurate cost of what it would take to rebuild the Shawnee County Courthouse?
That is our estimate, yes. And did we not do an evaluation on that last year, year before, on the courthouse?
We've talked about it.
Yeah, we've discussed about doing evaluations on
Okay.
that.
And then it strikes me as some of those values of what we look at is, I look at the Expo Center. The Expo Center Agricultural Hall Land and Arena is at 29. back to it. 29 million. And again, just looking at, if we're looking at contemplating an investment into 29,958,752, if we're contemplating a 45 million or 40 million or 30 million or some undetermined amount for the Expo Center, that seems, or again, are we looking at the insuring it for the accurate, what it's going to take to, are we insuring it at the proper amount?
That would be our intent. Is there questions or concerns regarding that? I know we've looked at valuations on a square footage, and the underwriters are very, very interested in being insured at value. They don't want to be underinsured. So they obviously want to collect the accurate amount of premium for potential loss.
And again, my concern is that whether or not we are underinsuring what it would take to rebuild some of these facilities in the case of a catastrophic event. Commissioners, are there any thoughts or questions that you may have? All right.
And we'd be happy to readdress that, Cindy, and look at it over this next coming quarter at doing some evaluations, and then
It just strikes me as whether or not 31 million is going to,
Is
31
inaccurate.
million sounds like an exceptional amount of money until you go to build something,
Yeah.
and then whether or not that would, again, if there was a catastrophic event at the courthouse, whether or not it would cover what it would take to rebuild it.
certainly. Well, we'll do an evaluation on that, and we'll get back to you.
All right.
Thank you.
Are there other questions regarding this? Okay, thank you very much.
Thank you.
Cindy, before we take action, how often do we work with, we know we've worked with Willis for a significant period of time, and we've been very satisfied, but is this an item that we take out for bid or review on an annual basis? Or?
No, it's like the professional services we have. It's just the same with our health insurance and stuff. We work with them. They are a multi-line, and they're more than just just a normal broker too. We dealt with them since before I've been here, because it was Sergeant Manley, then it was Charlton Manley, and then it was HRH, and then it was Willis. So it's one of those. I don't know that they don't necessarily charge us a fee. They charge, you get the better, rate, and I guess, they're good, they're easy to work with, they're here, plus they also have a presence, they have their presence in Topeka, they have a presence in the Kansas City area, and it's, like I said, similar to the Blue Cross and the Metrax. We have, you can get the people that cover it, or that represent you, and you just get comfortable with the people that you have to represent.
Again, not that there's any
No.
disappointment or dissatisfaction, but I know that we've looked at, and this commission has reviewed a number of contracts, including ambulance,
Right.
and going out for bid and review and so just following up on that, just
Yeah.
same practice.
Yeah, because there would be, it would be a, I guess I'd have to speak to Rich about what exactly would involve something like that, because it would be a major undertaking to do, I don't even know if it would be an RFP or how exactly would we go about it, because,
I think it's just a good practice for corporations and businesses and governmental entities to do a standard review from time to time to make sure that we're getting the best service that we can and best price for our professional services. And so, again, not expressing any dissatisfaction at all with Willis. We're, again, very satisfied, don't want to, but again, we've just done that as a commission here with all of our contracts. Are there any other comments?
If I may, Mr. Chair, and I think that's an excellent point. I know the last time we looked into this, I talked to some people in the industry about Willis, and they had nothing but excellent things to say. They're probably the premier, or one of the premier brokers in the United States. So I didn't have any particular concern after looking at and talking to other people in the business. So, but I think it's always good to look at everything that we do and question, does this
Right.
continue to be a good idea? So.
Good. Any questions? I'll move for approval of the 2016 insurance coverage with Willis.
Second.
Motion made by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. All opposed? passes 3-0. Our next item.
Item B, facilities maintenance. Number one, consider approval of request to fill facilities maintenance Shawnee County electrician position at a salary of $49,733, including benefits.
Morning, Commissioners. Bill Kroll, Facilities Maintenance Director. First thing, there is a typo on that. That should be plus benefits, not including benefits on that position. Which is step 13 of grade 13. And the candidate we have easily meets the qualifications that we've set, even exceeds them, and he wishes to remain anonymous until he knows he has a job. So, it does fall well within what we budgeted for 2016, so I'm comfortable that the
Bill,
money is there.
This is an item you took to the commission beginning with the budget discussions and back in August.
Yes.
Looking at the amount of money that Shawnee County was contracting out for electrician work, overtime, weekend, emergency pay. Do you believe that still that this is going to be a move that will actually save the county money in the long run?
Yes, I do. I think we'll get this savings right off probably in the first 6 months of 2016. We'll probably pay for this position. We have several large projects that are pending, some things at the health agency, and several things here at the courthouse that we need addressed very quickly. I know Pat Oblander in IT is anxious also to get somebody on board for a lot of his issues as well.
I know that a question that often comes up with my constituents is, are we hiring more people? Is government growing? Are we just adding people to add people?
No, we're basically taking the money out of the private sector and putting it right in here and have some money left over. In 2014, I believe we calculated about $90,000 was spent on outside electrical services. So at just shy of $50,000, plus the benefits, that savings will go back into the buildings and parts and things that we need, not just the labor of an outside service electrician.
Bill,
Commissioner Bueller.
yeah, thanks. Bill, who manages his time then and
It would be me.
prioritizes those requests that come through? You will do that?
Yeah, it'll come through me. And whether Parks and Rec needs an electrician for help, or Public Works, or IT, we'll be scheduling it through my office and making that person available to get those jobs done for me.
I know I said his, but it could be his or her. I
True,
don't know.
true.
Right,
In this
okay.
case, it will be a him
Okay.
if it's approved, so.
Thank you.
Any other questions? Commissioner Archer?
Yeah, thank you, Mr. Chair. Approximately what will be the total package? Do you know? I think we budgeted $70,000, is that correct?
In that neighborhood.
Excuse me, Betty Griner, Director of Administrative Services. Currently, our benefits are 22.5%, plus health insurance is another $7,200 a year. So,
60,000?
yeah.
Okay, so we'll be saving about $30,000 a year.
We should.
Right. Plus,
And-
this person will be full-time.
Right, exactly, and able to respond when we have needs, particularly on an emergency basis. Okay. Very good. I'll make a move to approve.
A second.
Motion by Commissioner Archer for approval, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Thank you. Our next item.
Item C, information technology. Number one, consider authorization and execution of contract C 565-2015 with Apex Sequel LLC for Apex Sequel Universal Software for $1,199, paid from the Information Technology 2015 budget.
Good morning, Commissioners. Pat O'Blander with the Information Technology Department. This software is a toolkit, basically, that our database administrators use to help manage the daily activities of the SQL databases that we employ to support all the systems throughout Shawnee County. In particular, it helps us interpret logs of transactions that have occurred and give us the ability to roll back or rerun transactions that may have been entered in error or just need to be redone to tighten things up. If you have any questions, I'll be happy to answer those.
Any questions regarding this? I'll move for approval. Is there a second?
Second.
Motion made by Commissioner Cook, seconded by Commissioner Archer. All in favor, say aye. All opposed, Passes 3-0. Thank you.
Thank you, Commissioner.
Our next item.
Item D, Health Agency, number 1, consider authorization and execution of contract C-566-2015 with Greenway Success EHS for management of billing services and reimbursement of insurance plans at the Community Health Center at a cost of, for implementation of $10,000 and 8.5% of monthly collections, or a minimum of $10,363 per month.
Good morning, Commissioners. Alice Weingartner, Health Agency. The request before you, as was noted, is to essentially outsource the billing aspects of the Community Health Center. Over the last year, we have worked in maintaining those functions internally, and with the professional change, we've had ongoing challenges with staff turnover, staff training. The vendor that we have used for our EMR for the last 5 years has the ability to provide the billing service to us, and so what's before you is the contract for that function. With this change, there are 4 positions within the Community Health Center billing staff that are account clerk 2s. 2 of those positions have been being filled with temp staff because we've been unable to fill them with full-time staff. 2 of those positions are filled with full-time staff. One of those positions would be retained because we still need to have some internal staffing to serve as a point of contact with the vendor. And then that 4th position will be moving to another county department, so there wouldn't be any result in layoffs in the union positions. And I did have conversation with Mike Scribner as well, and he is comfortable with this contract because it's not resulting in any impact on current full-time employees. There are 2 other positions that we would continue to maintain in there as well. The business office manager would be the direct point of contact with the vendor for this implementation, and then we would retain the assistant business services manager at least through June in an effort to continue that oversight and that operations of the office so that we don't get behind in billing aspects either for the Community Health Center or the local health department. So I'd be glad to answer any other questions.
Are there any questions regarding this request? Commissioner Archer.
This is a money saver, isn't it?
It is a money saver. We anticipate that it will be a money saver. One of the things that we anticipate the vendor will be able to do, will be able to help us in increasing the revenues that are coming in. They have experts in the billing field who will work to identify maybe some revenues that we haven't been collecting on consistently. So we anticipate that it will be a revenue saver, yes, a money saver.
It's kind of interesting how we look at the electrician situation and we bring somebody from outside in
Sure.
because it makes business sense and saves money. In this case, we're taking our billing function for the health agency and moving it outside because there's a good business case and it makes sense.
And just to be clear, it's only for the Community Health Center
Right.
function. Yeah.
Not the local health.
Correct.
Okay. Interesting. I'll make a motion to approve the contract.
I'll
Commissioner Bueller?
second, and just transition mid-year, we've accounted for all that in this.
It has been
contract.
accounted for, yes. The other thing, my brain just went off. It's still on holiday thinking. It's gone.
But we've accounted.
Yes, that has been accounted for. We do have one contract, one provider contract that's on an odd renewal time from our other provider contracts. That one we will not continue as of April because there won't be a need for that additional provider contract. So that'll also reduce cost as well.
Okay, thank you.
All right.
And a second.
Motion made by Commissioner Archer for approval, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item D2, consider approval of request to change language line service provider to Voyance for interpretation services through a call center at an anticipated cost of $8,727 annually and an initial setup of approximately $100.
Commissioners, this request is to change the vendor that we have been using for our internal interpretation services. Both the Community Health Center and the local health department do utilize both interpreter staff as well as bilingual staff. And as we look, at least on the Community Health Center side, for continuing to look for ways to address cost, we want to make sure that the staff that we fill positions with are bilingual. That's one of the things that we're striving for. In doing so, that means we have a reduction in some of our full-time interpreter positions, and so we have to have a way to be able to meet the needs of the patients as they come in. So we're proposing using this vendor, Voyance. This vendor came to my attention from a couple of our providers who have spoken with peers in the medical field and who have used this particular vendor for their phone interpretation service. I will note that there is a cost difference between there was a third vendor that we also looked at, which would show a cost savings, but one of the concerns that we had to do with the fact that they are not call center based, and nor are they medically terminology trained, which is really important in the field that we work in. Some of the challenges we've had with the current vendor, who we've used for a number of years, are phone calls being disconnected. Those call workers are not call center based, and so sometimes they are just in their homes, so they're challenged by whatever's going on in their homes while they're also trying to address the patient care that's taking place in our exam room here. So we're proposing that we make a change to this vendor and asking for approval to go with Voyance. And I'm guessing that's how it's pronounced too, Ms. Beck.
Questions regarding this? I'll move for approval of the Voyance language line.
Second.
Motion made by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. All opposed? Passes 3-0. Our next item.
Item D3, consider approval of request to advertise and fill clinical support positions as they become vacant.
Commissioners, this request has to do with the fact that we continually have turnover, particularly in 3 areas: our registered nurse positions, our licensed practical nurse, and our clinical medical assistant positions in the community health center. My hope is by getting your approval to move forward with filling these 3 positions as they become vacant, it will save us about a week or 2 in approval time and getting these positions open for advertising. We would continue to follow the guidelines that are outlined in the union agreement so that those positions are opened accordingly. But these 3 positions are really in their own bargaining unit agreements, and so there'd be little impact to the larger union master agreement or the agreements that covers much broader scope of employees. I did have a discussion with Director Cole, and this is an action that they've had in place for a number of years with some particular positions in their department, and he has said that he has found it to be very helpful to be able to make that move a little bit more quickly when it comes to filling some pretty key positions. So I'd be glad to answer any other questions.
Any other questions regarding this? Commissioner Archer?
Yeah, I'd like our HR director, he has thoughts on this process? Because it is a change of how we typically do business, is that correct?
Right. Jim Crow, interim director. I don't have a problem with this as long as you have a problem with it, and I can work directly and feel comfortable doing that. I've seen this happen over the years on different occasions, depending on the circumstances and the need that arise. So I'm okay with it if you're okay with it.
If I may, does this set a precedent for John Knight or others to come forward and say,
well,
why do I need to follow?
Certainly allows any department head to come forward and say, I'd like to do this too.
Okay.
I would think that department head would need to be able to make the case for being allowed to do that. And some might be able to make that case, and some may not. If you feel that the circumstances are present for doing that, in this case, I'm comfortable with working with Alice under that situation. If you're uncomfortable going down that road, then don't do it.
And can I just add for clarification is that these would only be positions that have already been approved through the budget process. If there was ever a need for a new position to be filled, then that would definitely come before you for approval. But this is already currently approved positions.
And so, just to summarize exactly what the request is, if you have a person who is currently employed with the health agency, they leave employment, rather than coming back to the county commission to fill that position with a new employee, you would be able to go directly to HR and say, we need to fill this position.
That is correct.
However, if there's a creation of a new employee position, that would then come back to the commission for approval.
That is correct.
So the difference is that under the current methodology, should the county commission not want to fill that position or have, in essence, a reduction in force, we could not approve that refilling. And in essence, that's the current methodology. Is that correct? I mean,
Yes.
okay.
Under the current system, every position that comes open, you approve filling. And you decide at that point whether you want to go forward with that.
Or decline.
Exactly.
Questions, commissioners?
But the structure that's going on in the corrections office, my understanding is that for security personnel, which is that critical staff, those positions go directly to you for filling.
I'm not familiar with that, if that's the case. I'd have to check on that.
Eve Kendall, Department of Corrections Deputy Director. We currently have an understanding that if we have officers, vacancies for officers that we already have budgeted, if there's a vacancy, we don't have to go through the process of asking for permission. We're just able to go ahead and fill it. It's as needed. Instead, we don't have a close date, basically, because we have so many openings.
But do you recall why that exception to the rule was made?
Because we were coming to the commission routinely, often, asking for permission to fill an officer's position. We currently have 25 vacancies for officers alone. So instead of coming to you every week saying we need to fill this position because we have such a turnover, we've had it approved.
And that was because of the dramatic level of turnover.
Yes, sir.
Is that what your proposition is based on also, Alice?
Yes, we are seeing a significant number in turnover. As a matter of fact, if this is not approved, then I will be bringing forward a request to fill some more positions that have recently become vacant or will be becoming vacant due to resignations. So these particular positions are just critical positions to supporting the providers, and as quickly as they have been changing over because of the anticipated changes going on with the operation, I'm just trying to find some ways to have a reduction in some of that time that it takes to get through this process, to get the positions filled. They're critical.
But again, going back to the purpose behind it, earlier today, we approved the filling of an electrician position. If a year from now, the electrician should leave us, and we have information that the electrician, Shawnee County had no electrical problems in 2016. We would have been potentially kicking ourselves, saying we could have saved $60,000 by not hiring that electrician. And it's just part of what we don't know. I'll move for approval of the variance in this case. And again, should be noted to all department heads. This is not saying this is a open invitation for all department heads to do this, but in this case, we have a high turnover rate, we have exceptional circumstances, and a need to fill those positions more quickly than our current methodology allows. So motion by Commissioner Cook.
I'll second, and reading from the memo, will ensure appropriate coverage to minimize impact to patient services as well as stress on the system. So, yes, I second.
I'm going to vote no. I think we give up a little bit of our monitoring oversight when we do that. I can understand the jail, but I'm not convinced that this is appropriate, so I would be voting no.
All in favor, say aye. All opposed?
No.
Passes 2-1 with Commissioner Archer dissenting.
Thank you,
Thank you.
Commissioners.
Our next item.
Item E, Parks and Recreation. Number 1, consider authorization and execution of contract C-563-2015 with British Soccer, a division of Challenger Sports Camps, for soccer camps and clinics at the Bettis Family Multipurpose Field and Shawnee North Community Park, with a portion of camp fees remitted to Shawnee County.
Good morning, Commissioners. Sean Osborne, Parks Plus Recreation. This is a contract that we've had with them before. It's something that helps us out in moving forward with our partnering with different people to come and produce a camp that we could do a camp with just doing soccer, but they bring the part of British and everything else with it. You know, we do have a lot of people that participate in this, so I'd be happy to answer any questions you might have.
Sean, last week we approved the creation of a revolving fund for summer camps. Is this part of that revolving fund, or is this separate from it?
No, this is something that's separate, yeah.
And so they are in essence, and again, it says in the memo, but they're an independent contractor. They are not Shawnee County employees.
No.
They're just contracting with us.
Yes.
There are the questions.
Move to approve the contract.
Second.
Motion for approval by Commissioner Archer, seconded by Commissioner Bueller. All in favor, say aye. All opposed? Passes 3-0.
Thank you.
Our next item.
Item F, elections. Number 1, consider approval of request to encumber $12,500 from the 2015 election office budget for payment to the Office of the Kansas Secretary of State for the 2016 Election Voter Information System workstations.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. We're really not trying to encumber this. We have the invoice for this. I think the way we worded it was a little confusing, but we really just need permission to pay the bill. What this is the ELVA system, is the Elections Voter Information System. It's how we maintain registrations. Going to be critical starting January 1 that we have this paid so we can go ahead and continue taking care of registrations. I do want to say a public thanks to the Secretary of State's office. I know that the amount they charge the county seems fairly high, but we've done a little research into it. They do not charge us the full amount that it actually costs them. So to their credit, they're working hard at keeping that as low as they can. They've been able to kind of hold off any increases for a while. So just wanted to publicly note an appreciation that they work pretty hard at keeping those fees as low as they can. And it doesn't reflect the full cost that they pay. So just ask for your permission to pay that.
Any questions regarding this item? Motion?
So moved.
Motion by Commissioner Bueller for approval.
Second.
Second by Commissioner Archer. All in favor, say aye. All opposed? Passes 3-0. Thanks.
Thanks.
Our next item.
Item G, Commission. Number 1, reflect appointment of Pam Wallstrom as the at-large position to the Expo Advisory Board for a 3-year term commencing January 1, 2019.
Commissioners, this was due to a resignation. We did take applications. I believe that we've all had a chance to interview Ms. Wallstrom independently. I would move for her approval to the Shawnee County Expo Center Advisory Board.
I'll second.
Motion made by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. All opposed? Passes 3-0. Congratulations, Pam, and look forward to working with you. Our next item.
Item G2 has been deferred. Item 5, Administrative Communications.
If there are any department heads or members of the public that have any items to bring to the commission today, this is your opportunity. And I see the treasurer approaching us with holiday greetings.
Tax man.
Good morning, Commissioners. Larry Moss, Shawnee County Treasurer. Just a reminder that we will be closed at the Treasurer's office, including motor vehicle offices, on December the 31st to close the books. Closed to the public, but at work. So, thank you.
Thank you. Commissioner Archer, any administrative communications?
Thank you.
Commissioner Bueller.
Just a reminder for the position on the Shawnee County Fire District. We have 1 week remaining for those who are interested and want to submit their names. The requirement is that they live in Shawnee County Fire District number 1. And again, if you need help in determining where that is, please call me. It encompasses 3 different townships, but for our appointment, that person only need to reside in Shawnee County Fire District number 1. So, thank you.
Thank you. And I don't have any administrative communications this morning, so that draws us to our next item.
Item 6, Executive Session.
There is a need for an executive session today. I would so move that we adjourn into executive session on the following matters: personnel matters of non-elected personnel, consultation with the attorney for the body or agency that would be deemed privileged in the attorney-client relationship, and matters relating to employer-employee negotiations, whether or not in consultation with the representative or representatives of the body or agency, and for a period of 20 minutes.
Second.
Motion made by Commissioner Cook, seconded by Commissioner Archer. All in favor, say aye. All opposed? We are adjourned into executive session for 20 minutes.
Okay.
He's been bragging about his.
John, hard to believe.
I know, it just makes no sense, does it?
So out of character.
We are back from executive session. No action taken. We are adjourned.